Hello and welcome to Anatomy Coloring Book, page 38. This is Dr. Harkins. Today we're talking about the bones of the thigh and leg. Bones, starting with the thigh. The big bone in the thigh is called the femur. That's this bone right here, and we're looking from the back. It's this long bone right here. And the femur articulates with the pelvic bone right here. This is the pelvic pelvis, or the coxal bone as it's called, at the hip joint. So the femur is actually shaped like this. It has a round head. This is called the femoral head. As you can see right here, the femoral head. This is the view from the front. And it is articulating with the hip, or with the pelvis, or the coxal bone right here. And the pelvis has a concave area called the acetabulum right here that articulates with the round convex head of the femur, and that is your hip joint. The area here, this little protrusion right here, is called the greater trochanter of the femur, and you'll see it over here. So as we talk about bones, every little bump on every bone has a name, and it's because what happens at these areas is that there are muscles that attach to these areas. For example, the glute, the gluteus medius, say, is a muscle that goes from the pelvis, the coxal bone, and attaches right here on the greater trochanter of the femur. So you should get used to identifying and knowing what these bumps and ridges are. Again, the greater trochanter of the femur, a very common site for strong muscular attachment. This area right here, another bump on the medial side of the inside of the femur, is called the lesser trochanter. Lesser because it's smaller than the greater trochanter, and lesser because it's underneath or inferior to it. Here it is from this view right here. This bump is called the lesser trochanter. And then in between the greater trochanter and the lesser trochanter is what we call the Intertrochanteric Crest. Again, these bumps are very important because they are attachment sites for muscles, insertion points of muscles and muscle tendons. Coming off of the greater trochanter, we have this line right here. It's a roughened area and raised area of the back of the femur called the linea aspera. And it is the attachment point of many of the muscles as well. For example, some adductor muscles that bring the thigh inward will attach there at the linea aspera, plus many other muscles. The linea aspera only exists on the back, on the posterior side of the femur. There is no linea aspera on the front of the femur, on the anterior side of the femur. But notice how this is the shaft of the femur, by the way. Notice how the shaft, as it descends inferiorly, it widens to these two areas right here called condyles. Femoral condyles. In other words, condyles of the femur. And here they are on this side. And each has a name. This is called the medial condyle on the inside right here. And this is called, of course, the lateral condyle. And in between the femoral condyles, the medial and the lateral, you see a groove here, a groove. And in this groove is contained over here, oh, excuse me, that's the posterior. But on the anterior side, there is a groove right here. And in that groove, the intercondylar groove, I guess you could call it, and the patella, which is a sesamoid bone, the patella articulates and slides up and down that groove. And on the posterior side is the intercondylar fossa. So the condyles have a fossa or a dip in between them on the posterior. Note that the condyles are rounded and convex here on the inferior surface, or convex, and that's going to become important when we talk about the tibia. But there is one small part of the femur on the condyles, the top part of the condyles, a sort of peaky, sharpened point called the epicondyle. Epi means above. So there's on the lateral side, on the outside, there's an epicondyle. And on the inside, there's an epicondyle, a medial and lateral epicondyle. Oh, you got it? Anterior to the tibia, anterior found on the tibia, is this little area right here. It's a raised area of the tibia called the tibial tuberosity. And here it is over here in a sort of blown up diagram of the anterior knee. And the tibial tuberosity is the attachment point of the patellar tendon. This is the tendon that the doctor taps with his or her hammer to make your knee kick forward. And the tendon inside the tendon, the patellar tendon, is the patella. We talked about this patellar bone right here. And here's part of the patellar tendon as well. And sort of the patellar tendon sort of envelops or the patella bone. It's a sesamoid bone that is inside the tendon itself, and the tendon attaches right here at the shin bone, at the tibia. Tibia is your shin bone on the tibial tuberosity. Following the shin bone down to the ankle, we have here on the inside, the medial side, what's called the medial malleolus, right here. It's the bump on the inside of your ankle called the medial malleolus. And next to the tibia is this small little bone on the side of the leg called the fibula. And the fibula, as you follow it down and trace it down, at the bottom is the lateral malleolus. Here, and then let's continue to trace. Here. That's your fibular bone. This is the head of the fibula up here, the neck of the fibula right here, and the distal fibula, the lateral malleolus, and then up the shaft to the proximal fibula. And the fibula and the tibia form a joint right in here. Two of them. Right here is called the proximal tibiofibular joint right here. You can see right here. And as you follow it down here, the distal tibiofibular joint right in here. There's a little joint there and right in here. The proximal tibiofibular joint and the distal tibiofibular joint. And in between the two bones, what you see is this membrane called the interosseous membrane. The interosseous membrane. And here it is from the front view here. The interosseous membrane. And that could also be considered a joint as well. It's a syndesmosis type joint. Some may call it the intermediate tibiofibular joint. So at the proximal end of the tibia, of course, was the knee joint. And at the distal end of the tibia and fibula is what's known as the talocrural joint. This is the talus here. It's a bone in the ankle called the talus. Right here, it's kind of dome-shaped. And it articulates with the tibia and the fibula right there. You see how the tibia and the fibula together formed a sort of dome-shaped joint with the dome-shaped talus of the ankle. And here it is over here. The talocrural joint, also known, of course, as the ankle joint. And of course, the close-up look of the knee joint from the front, from the anterior view. Here's the femur here. And then it's covered by muscles and ligaments and tendons. Of course, the patellar ligament we talked about with the kneecap or the patella. And the envelope of tendons and the tibial tuberosity or the tibial tubercle. And then hiding underneath there, you can see this is the tibia bone here, right? Here's the fibular bone out here, the head of the fibula. This is the proximal tibiofibular joint. The condyles, the medial tibial condyle over here, the lateral tibial condyle. And it's wrapped in all these muscles and capsules. And this is the sort of capsule of the knee surrounding the knee. And there are muscle insertions, muscles coming in. The iliotibial band is coming in here, which we'll learn about later. The quadriceps muscles are coming in and attaching on both sides here. There is a ligament on the side here called the fibular collateral ligament. It goes from the fibula and into the knee and stabilizes the knee. Over here, of course, there would be what's called a medial collateral ligament, and over here would be a lateral collateral ligament on the knee. And let's look at the back of the knee. Here's the femur again. Right here. Tibia down here. and it's wrapped in all kinds of muscles and ligaments and capsule, joint capsule, etc. So there's a capsule that surrounds the joint and protects it and holds the fluid inside the joint. There's tendons from the hamstring muscles, the semimembranosus, the tendon of the biceps femoris, which is another hamstring muscle down in here. And ligaments coming across, popliteal ligaments. Popliteal means the space in the back of the knee, called the popliteal area. The plantaris muscle, the calf muscle, the lateral head of the calf muscle right here, the medial head of the calf muscle. They're cut. They're all cut so you can see what's underneath. But you can see the vast array of muscles that are crossing the back of the knee. Muscles, tendons, and ligaments, as well as here, crossing the front of the knee. And we'll learn all about those in more detail in upcoming lessons. And this is Dr. Stephen Harkins, and this is page 38 of the Anatomy Coloring Book.